I would like to welcome Michael Lowe. Michael, as you know, graduated from the Naval Academy. He also has a master's from Georgetown University and his law degree from the University of Alabama. He has a practice in Longwood where he practices mostly in physician and other healthcare providers. When we were trying to find somebody to come tonight, we wanted somebody with a physician perspective, but also someone who understood hospital operations. I think hospitals and physicians, the HIPAA laws apply equally, but there are some nuances to each setting that are important. And Michael certainly fills that bill. He was past counsel to the Florida College of Emergency Physicians. He's board certified in health law, member of the American Health Information Management Association. He speaks and writes extensively in many healthcare regulatory areas, but in particular the privacy. So he's going to talk about both the Florida statutes about governing patient privacy and confidentiality of medical records, and also the federal HIPAA rule. So, Michael?
I'm going to start with a couple of quick anecdotes for you because I think these are very illustrative. I represent a lot of doctors. There's a lot of them here tonight. They know me. I'm very physician friendly. So I'm not here to scare you. I'm not here to try and tell you that you're doing things wrong. But I am going to tell you, if you don't follow these laws, they are becoming extremely dangerous for you as physicians. We had a new decision in the Florida Supreme Court this year where a plaintiff sued a physician and several other folks for a breach of privacy. You can't sue under HIPAA. There's no private cause of action. The government did not say, if Michael Lowe goes out and breaches Miriam's HIPAA rights, that she can sue me. You have to sue under common law in a Florida court. But the Florida Supreme Court upheld a trial decision that if the plaintiff can prove a prima facie, that means a complete case of a HIPAA violation, that's enough to hold the healthcare provider liable. And they awarded punitives in the case to the tune of about $8 million because it was an HIV positive patient. And that's what was disclosed. I've also done probably over 1,500 licensure cases against all the boards. I'll be seeing our friends at the Board of Medicine on Saturday in cases. I do all the boards. I can tell you that's a real number. I have to keep track of it. Rob's board certified. He'll tell you that we have to submit actual numbers to get our board certification, much like you do. And I'd say probably 30% of those cases have involved medical records privacy violations over the years. That's a real number. Okay? Patients are looking for any excuse they can right now. It's a tough economy. They're looking for money. They're looking to sue. And reports to the federal government are at an all-time high. Over the last 5 years, the statistics from HHS, the Office of Civil Rights, the HIPAA police, track exactly what Susan showed you. They are going up 12 to 15% a year. The number one type of violation every single year since HIPAA has been in effect in 2003 has been wrong or inappropriate release of information. And many times it's inadvertent. And I'm going to try and tell you some real-world stories this evening to put some meat on the bones of these handouts. Now,